I'm going to spend a little bit of time examining some of the challenges for health promotion in regards to alcohol, and look at what might be important principles for what I'd call strategic initiatives, and with the focus on what I'd call integrated programs. I'm going to discuss some recent developments both in and out of alcohol, because I think there are things that we can learn across health promotion that might actually help us think a little bit more widely about the sort of things that we do to try and influence and change the way we consume this commodity. The most important thing is, I think, the focus here is on being strategic. On how strategic you are is really about how you relate yourself to the policy environment at any point in time, as well as engaging with the evidence. And so that's going to be the important thing as I look across, and it's going to be fairly disparate. I'm going to work across a couple of different areas. So we're going to be talking about what we mean by integrated campaigns, the notion that alcohol consumers are really media consumers, and that look at trends in other places around how we communicate and engage. And finally, to actually look at a term called the social licence, and to appropriate that term a little bit and to apply it in the way we think about the licence we give to the alcohol industry to create harm in our community. Many of us in the public health arena have been very wary about using the term cultural change. It's a term that's been used by the alcohol industry for some time, and it's been a term that's been used whilst claiming a rhetoric of changing culture, but at the same time undermining strategies that actually are very, very effective. So things like taxation reform and changing in access and availability to alcohol are being used at the same time. So resistance to those strategies is being used at the same time as employing a rhetoric of we're all up for cultural change. And it's an interesting comparison. So this is a piece of text from Lion Nathan, executive, who said that like skin cancer awareness and anti-drink driving campaigns of the last decade, Drinkwise Australia worked closely with governments and community groups on developing evidence-based campaigns that empower individuals to make better choices when drinking and change what Australians consider to be appropriate behaviour. Now, the focus here is on empowering individuals, and this kind of individualist and what we call behaviouralist approach we know is one of the least effective strategies to create cultural change. Culture is actually more than just behaviour, and it's more than just the conduct of an individual. The essential ingredient missing from many of these individualist kind of strategies are the material changes that actually affect the social conditions where consumption occurs. In tobacco and in anti-drink driving, there were both concrete prohibitions and social sanctions put in place to accompany a lot of the social marketing that we did that had such dramatic and well-received effects. Social marketing needs to be integrated with policy change and changes in the material environment. It's no use in a television commercial or in a poster to actually create a call to action. That is, we want you to do something because of what you're looking at. It's no use to actually say to people, we're going to call you to action if actually there's nothing to do, or if there's no change to the material environment that enables people to make those changes. We know this from the experience with integrating the social marketing activities in legislative reform and in using things like the quit line in tobacco control. We also know it from the TAC campaigns. So this interaction between how we influence culture and influence individuals, that this interface between individuals and culture is absolutely essential when we start talking about cultural change and we start talking about strategic approaches to cultural change. And that's what, if you all fall asleep right now, then you've got the talk, okay? This is the traditional sort of picture that health promotion uses when they talk about changing and improving health and well-being. It shows that in order to promote and to influence the individual, I'm using my finger, but that's actually not doing it on the screen, is it? No, I'm not getting any advice either. So in order to influence the individual, you've really got to work at the context in which they're situated as well. So in this case, the traditional categories of family, community and society. But implicit in that, but not explicit, is the role of the market. And in this case, what we really need to actually acknowledge is that the market is as strong a determinant of behaviour as is the community and social conditions in which people live. And it's to this that I'm going to point towards today as well. Now, the UK Cabinet Office produced a fantastic document that looked at cultural change. And if you ever get a chance, if you're not doing anything on a Saturday night or if you're just relaxing, then it's a fantastic document to look at a framework for thinking about cultural change that goes beyond just trying to influence what people think and what they value. It actually goes into talking about how we influence the material structures that shape people's choices. Part of this document was looking at society-wide influences and immediate influences. These are things that they talk about. And again, this is just a framework. I'd really encourage you to go to the document and explore it. And you can really see points of leverage or points of influence within the material context of alcohol consumption that would be amenable to change. This is material from a review of culture and alcohol from Bolagden. And it's a fantastic review, and it talks about the ways we think about culture. And again, culture not just as a set of ideas that are in our head or a set of beliefs about what we should be doing in the world. That culture can be thought about, in what they call classical sociology, is they talk about a structure, function and cognition. That is, the world is ordered with certain structures, that they do certain things in terms of functions, and that there are certain ways we think about the world that actually bring us together. And that's what they call a kind of classical sociology or anthropology way of thinking about culture. Culture, however, in more modern terms, is actually a little bit more nuanced than that. Culture is actually embedded in how we buy things, not necessarily about the structure we live in, whether we're this religion, that religion, or whether we're in this kind of household or that kind of household. The consumer culture is a powerful force that shapes what we do. I don't know about you, but when I went to Kmart last week and saw $10 jeans, I was influenced straight away. Not because they were great jeans, but $10, you've got to buy them. Anyway, that's just me. Life trajectory is really important. So the work of Giddens and Beck is very important, actually saying that culture is determined by where we are in our life trajectory. It's born out of our history of interactions with people, born out of our relationships that happened 10 years ago. Culture is shaped as an identity resource. It's something I draw on to make sense of who I am. Culture is about what groups I'm a member of, formally and informally. And that comes from the work of Mafasoli. And finally, that culture can be thought of as about the sharing of symbolic meanings. So the fact that I know what Buffy the Vampire was saying, and there's probably 15 people in the room here who watch Buffy the Vampire Slayer, that's an important creation of symbolic meaning that we share, and that provides a cultural resource for me. Now I can see a number of people going, Buffy the Vampire Slayer, yeah. Yeah, not that many, I'm making it up. Now, going beyond the kind of social collective, and this is where it gets a little bit wacky, is that there's been some really exciting work emerging from cognitive neuroscience that says that, and we usually talk about neuroplasticity in terms of the negative effect of alcohol on brain function. Yep, you've probably heard a fair bit of that. There's some really interesting work from cognitive neuroscience that talks about the effect of culture on neuroplasticity. The culture itself has an impact on how the brain functions and also the structure of the brain. Now, this is probably stuff that gets a little bit wacky, but it's actually really important. Some really important, and this is being led by neuroscientists, not sort of wacky philosophers. The commonly held view that culture simply alters the way we interpret the world is now being supplanted by a view from neuroscientists that the brain biology changes in relation to the perceptual stimuli that we receive. So the idea that the brain is just an independent organ just chugging away on its own is actually being supplanted now, that actually the brain changes by virtue of the effect of the environment. Okay? Now, what's really important is if we think about what's the kind of environment that we actually are exposing young people to. And the environment is one where actually the main focus for me to talk about today is around the exposure to alcohol industry communications through the forms of sponsorship, advertising, and through points of access and supply. This is a real challenge for health promotion. The alcohol industry is large, it's well capitalised, global in reach with significant influence. And the influence is not through simple force of history. The industry invests heavily in sponsorship and advertising in a range of settings to maintain public confidence in the social utility of alcohol and to ensure that the community grants a social licence to the alcohol industry to continue promoting a product in the face of significant social harm arising from the product itself. Now, most of you would know about the systematic review conducted by Anderson and colleagues in 2009, and if you don't, then it's a really good one. It's clear that the exposure, and it's really clear, this was a review of longitudinal studies that said it's clear that the exposure of young people to the volume of media and commercial communications increases the likelihood that adolescents will start to use alcohol and to drink more if they're already using alcohol. There is nothing new to those, and this isn't particularly new to those in the field, but what the review clearly demonstrates is that the media environment is contributing substantially to the risk of harm. It's consistent evidence to link alcohol advertising with the uptake of drinking amongst non-drinkers and increased consumption amongst their drinking peers. If you haven't got it, grab it, because it's actually a really good review. This is the kind of, when I talk about culture, media, exposure and neuroplasticity, then on the one hand we've always talked about the neuroplasticity and the neuroadaptive effects of alcohol on the brain. I'm actually talking about the impact of culture saturated with alcohol advertising on neuroplasticity in the brain. Slightly different way of thinking about it. Now, if we look a little bit about the levels and types of sponsorships, this is looking at sports sponsorship from material that was presented about a month ago in New Zealand from Ingrid Wilson on behalf of the Good Sports. And there they did a survey of the Good Sports clubs, around 2,500 clubs I think the survey was, and when they looked at those who received sponsorship, 68% of those clubs actually received alcohol sponsorship, and that was mostly in the form of licensed premises, liquor retailers and to a small extent liquor producers. So actually the picture of alcohol sponsorship is being dominated at the club level by alcohol producers is not necessarily the correct picture. What this suggests is actually it's the local pub and the local retailer that actually are the majority sponsors for local community clubs who get alcohol sponsorship. And that actually changes the picture somewhat. It's no longer, we can't really think of the great boogeyman of, the great alcohol producers in the sky who actually, are putting this negative influence on people. It's actually the pub where your son or daughter works are actually the ones who are sponsoring the local football or netball or basketball team, which actually changes the way we think about the kind of social licence we give to alcohol to have a place in our lives. And I'll talk a little bit also about the seasonal exposure. Now, this is some data from Nielsen Media Research, and it's from the report done by the Intergovernmental Committee on Drugs for some years ago now, and there's been an additional report done since then. Now, in this report, what it shows is seasonal exposure to alcohol advertising, and if you look at the graphs, is anyone allergic to graphs? Oh yeah, maybe a few. Okay, so this is a graph showing the spend in millions across the month of the year on alcohol advertising. And what it shows is there are peaks in alcohol advertising starting from around here, around November, and here around August, September, and it continues on during this period. Now, this shouldn't really surprise too many people, but I suppose all I wanted to do is to illustrate that this is a really strategic and important impact on our media life when in those periods of the year we are getting saturated with alcohol advertising. And again, think back, the idea that culture actually has effects, and if we are to affect culture, then this is the environment that we are looking at, that we really need to look and address.